Healthy Wednesdays, brought to you by the sponsors of momseveryday.com.
There is an increasing prevalence of food allergies, especially in kids. They can range from uncomfortable to even life-threatening. Dr. Petra Razdan is here from Allergy, Asthma and Immunology Associates to teach us about food allergies. Hello, doctor.
Hi, how are you?
Good. Nice to have you here today.
Thank you for inviting me.
I know here in Nebraska we do have quite a few allergy sufferers.
Absolutely. We're quite busy at this time of the year.
Yeah. Well, tell me, what are the most common foods that will cause allergies?
Well, there's about 8 top allergens that cause about 90% of the allergies we see in the world. Those are tree nuts, egg white, not the yolk, milk, you have peanut, you have shellfish, and then you have wheat, and you also have fish and soy.
So how would you know if you or your child are allergic to a certain food?
Well, usually there's quite a short onset of your symptoms after the ingestion. You can have anything from just perioral hives, you can have shortness of breath, or you can have nausea and projectile vomiting.
And you don't really know ahead of time if you're going to be allergic, right?
No, you don't. You become sensitized at any point in time in your life.
Wow, okay. So tell me about the clinical symptoms of food allergies.
So you can have shortness of breath, you can have, as I mentioned, vomiting, you can have diarrhea and all over generalized hives, and also to a more severe situation, meaning you have anaphylaxis and you need immediate care.
And that would be life-threatening.
Absolutely.
So if you are at school, you have a child going to school, it's a good idea probably to avoid peanut butter, nuts. I know teachers say never bring anything like that.
Absolutely. There's quite a degree of cross-reactivity between different nuts and also peanuts, and it's hard to discern which nut you're exactly ingesting and which one you're allergic to. So we do recommend avoiding all tree nuts if you're allergic to one.
Okay, and how about oral allergy syndrome? What is that?
Well, that's a syndrome that's caused by, for example, if you have pollen allergy and you have oral symptoms after ingesting particular fruits and vegetables that are raw. For example, ragweed and banana, your body will think that you're eating ragweed when you're eating the banana, and you'll have oral itching, lip tingling, and sometimes 1 to 2% will have systemic symptoms, but usually it's a local reaction.
And are there some food allergies that are lifelong and some that will go away?
Yes, the lifelongs are usually shellfish, and tree nuts is very little the people that will actually outgrow. It's only 9%, and peanut about 20% will outgrow, the cow's milk, the wheat, and the soy. And the egg, usually about up to 85% of people will outgrow that to an adult age.
So if you have any questions about an allergy and maybe a reaction that you've had, come and see you guys?
Absolutely. We'll definitely listen to your history, and we can do testing. We can do skin testing if you had more of a minor reaction. If there was a major reaction, we will not skin test you. We will check for allergic antibodies in your blood pertaining to that particular allergen that you ingested.
So there is some help available.
Absolutely.
All right. Thank you, doctor.
Thanks.
And for more information on food allergies, go to momseveryday.com, find the health button, and click on the Allergy, Asthma and Immunology Associates page.
Moms Every Day, weekdays at 8:55 a.m. is brought to you by the sponsors of momseveryday.com.